Hi, I'm Dr. Natalie Marks, and thank you for joining us for the latest information and advice as we all navigate our way through the COVID 19 pandemic. Tonight, presented by the Viticus Group, formerly known as WVC, we're talking about one of the hottest topics for veterinary professionals right now, telemedicine. We'll be speaking live to Dr. Aaron Smiley, president of the Indiana VMA and telemedicine expert, and Dr. Jessica Vogelsang, the founder of PawCurious.com, who also consults extensively with veterinary professionals on communication strategies. We will also hear from Dr. Lori Teller of the AVMA to get their guiding perspective on telemedicine. We want to be available to answer your questions, so we encourage you to type them in during this broadcast. But first, we want to start tonight by bringing you the latest information on COVID 19. As you've all heard by now, and likely as I have heard from many clients, there was a report of a pug in North Carolina that tested positive for COVID 19. This morning, I had a chance to catch up with infectious disease expert Dr. Scott Weiss, and I asked him what is known about this case.
Well, I think what we know right now is basically what you said. There was a pug that was owned by a physician who had COVID, and there's COVID in the household with family members. And the pug was identified as being infected through a surveillance study. They report maybe some respiratory signs, although it's pretty unclear whether it had respiratory disease from COVID or whether it just had normal respiratory issues that a pug might have. So if anything, it was very mildly affected. But it was a typical case. It's the classic scenario, right? We got a person with this infection. They're living in close confines with other people and animals, and they can spread it to it. So the way I've kind of framed this is it's completely unsurprising, but bound to freak people out. And I think it's doing that. But it is completely unsurprising, right? We have a lot of people with this infection. And, if half of people in North America have pets or contact with animals, that's a massive number of animals that are exposed. And we know that there is some degree of susceptibility. We don't know if it's 0.1% or 1% or 10%. Because we have very few animals tested, but we expect some spillover. We know dogs are a little susceptible. They can get infected, but they probably don't get sick, which is fairly similar to this here. We know cats are more susceptible and they can get sick, but they're going to have kind of mild disease. So I think the take home message people are worried about this is, well, this report doesn't change anything. It's the exact same thing we've been saying actually for a couple months is, yeah, this is a human infection, but we can pass it on. Like there's spillover. We have no idea what that means in terms of relevance to the broader population. But I think the key for people that are freaked out is there's basically no chance your dog is going to bring COVID into the household if you socially distance it. Right? This is a human associated infection. So if my dog has COVID or a cat has COVID, they got it from me or my family members. So we've got a human issue going on in the household. So if I socially distance my animal, so I'm not letting it interact with other people at the park, or not letting it loose, not letting the cat go interact with people in the neighborhood, then there's no chance they can bring it into the household. So the risk actually is to the animal, not from the animal. So if we consider social distancing as a household activity, then we negate really any concerns about the animals bringing it into the household. So people can relax. If they use common sense, if you treat your animal just like you do your kids or your spouse in terms of their contacts, then we don't have to worry about it. From our standpoint, this is where the risk comes in as veterinarians, because who's most likely to be exposed when they wouldn't normally be, right? And that's us. So if we've got a cat in a household with COVID, all those family members are already exposed from each other. When you remove that cat, whether you let it out and wander the neighborhood or whether it goes into a clinic, that's when you see them as a potential concern. So that's why we're focusing on doing logical things in clinics. So, and that's an important message for clients is, okay, we're going to take some extra precautions because we don't want that escaping the household. But in the household, there's nothing else you're going to do. Treat your cat like your kids. Have a good time with it. Having this infection in this dog just reinforces the really basic messages, which is, relax and socially distance.
So let's go back to the practices for a lot of veterinary professionals that might be a little more hesitant around dogs. Are you recommending any extra precautions than what we're already doing within our practices with curbside check-ins and wearing masks or maybe wearing gloves now that we know that this dog is, we suspect, a positive case?
Yeah, this dog doesn't change anything again. It's the first diagnosed dog in the US. It's almost certainly not the first dog in the US. Whether it's in the first 100, we have no idea, right? We have very little testing that's happened. So it doesn't change what we've been saying because we've taken a bit of a cautious approach, a practical but cautious approach. And ultimately, again, the biggest risk, if we've got a dog that has this infection, the biggest risk is that owner. So we still, if we're doing our things like curbside pickup, we're distancing from owners, and that might be wearing a mask for the transition, limiting the contact. That's the big thing we need to do because the owner poses the most risk. The odds of any dog bringing it into the clinic are pretty low, but we can screen that to some degree. Like asymptomatic infection is complicated because we can't figure out everyone that's a high risk household. But if we do simple things like, okay, is anyone in your household sick? Does anyone have COVID? Is anyone self-isolating? Does anyone have respiratory disease of any manner? Now that we're getting out of flu season time, if they've got respiratory disease in an endemic area, treat them as a COVID positive household. And that might mean, okay, well, we really want to default to telemedicine, or we want to postpone it if we can. But if we can't, then we've got our plan in place. And that's how we're going to do the transfer. And that's how we're going to handle the animal with our basic PPE. And it's pretty straightforward, but the more we can do this in advance, it's easier to do it on the phone call. So, a half hour later, everyone's got a plan. Everyone's relaxed. They come in the clinic. Here's what we're going to do, as opposed to, oh crap, there's an animal here now from a positive household. What do we do? And we scramble and we panic. So it's just some basic questions. It's that basic infection control that we've been doing in most places for, a month or more.
Yeah. And I think that's great advice for practices today to just make sure that their protocols are in place in regards to their screening when people are making appointments. But finally, just the last piece with client communication, the CDC has come out with recommendations that clients and dog owners should not be going to dog parks in public areas. I assume you agree with that. Is there anything else we should be telling our clients besides the social distancing within their homes to help make sure that they keep their dogs as healthy as possible?
And it's not really not going to parks. It's not having uncontrolled access, right? So walking through a park with your dog is no risk if you stay away from other people and other animals. Like this isn't spreading through the air. It's not going to be on the ground. It's not a realistic concern. It's when we break that 6-foot barrier. And essentially, it's kind of like I say to people, if you wouldn't go to the park and let your kid go hug someone or shake their hand or hang out with them, you wouldn't let your dog do that because, if they're infected and they cough on your dog and maybe the dog gets infected, but maybe it brings it right back and you touch the dog. So we just want to cut down on those things. So again, it's treating your dogs like your family and socially distancing them. So if you go for a walk with your kids, but you keep them with you, we do the exact same thing with the dog. So get outside, enjoy parks, get some exercise and fresh air, but keep your dog on a leash and make sure it doesn't encounter any other animals, other people, and there's basically no risk for the animal bringing it into the household.
Dr. Weiss, thank you for your calm guidance and your expertise. We always appreciate your time.
Great, thank you.
Question from our viewers, Jane did ask, was this case confirmed by a national lab? And as of this morning, the CDC, AVMA, and the National Veterinary Diagnostic Lab were still trying to confirm that positive. So we'll have more information later in the broadcast. But thank you so much to Dr. Weiss for being available. You can always find the latest information from him at wormsandgermsblog.com. Now let's get right to our featured guests. Dr. Aaron Smiley, currently president of the Indiana VMA, and someone who is a very active user of telemedicine with his clients and patients. Dr. Smiley, I think the first thing I would love for you to share your thoughts on is what type of cases and patients are a good fit for telemedicine?
Patients and clients that you have a VCPR with, those are the best, right? And in most states that's legal, but start out with those. You know them. And then when we started offering paid telemedicine, we did medical rechecks. It was very easy. What we would tell people is use telemedicine. It's more convenient and less expensive. Now, in your clinic, you could charge whatever you wanted to charge. But in our clinic, when we started out, we made those rechecks on telemedicine a little bit less expensive. But it's a great thing for the doctor and for the client. For me, inevitably, I wasn't able to get my clients back in for rechecks, but I wanted to see how my therapy worked out. Was this good? I always assumed, well, no news is good news, but that's not always the case. So what we did is we went ahead and pushed a charge right there in the exam room for the recheck. And we told the owner, hey, Mrs. Jones, you don't even have to come back in. Just send me a video in 2 weeks, and then we're good to go. Owner thought it was great. So that's where we started to introduce paid telemedicine.
That's a wonderful starting point. But for some veterinarians, they might be thinking, I don't know if telemedicine is for every case. Are there any cases out there that might be challenging to use telemedicine with maybe right away?
Oh, yeah. And that's, I think, that the skill, the highly skilled veterinarian, she knows when to do what therapy. So in that regard, what's telemedicine appropriate for? You as the doctor are the expert. You know when that dog needs to be touched in the physical. There's a whole lot of problems that you can give advice and you can diagnose. I always tell people, what would you diagnose and prescribe for your sister-in-law? Oh, well, yeah, because I said, do your family members ever send you videos? Oh, they say, Smiley, I get videos all the time from my family. They send me, oh, diagnose this lameness. If you're comfortable diagnosing and prescribing for your sister-in-law, that's probably a pretty good litmus test.
I think everybody would agree there for sure. So for practices out there that are going to first start out delving into telehealth, we really have to be aware of what we're communicating to clients, right? Because they're the active team member on the other side of the platform. So what are essential communication points that all of our clients need to be aware of when we're starting to use this as a service at practices?
Make sure your clients know that there's going to be a charge. So this is a professional service. Veterinarians are great at telemedicine. We've been offering it for longer than I've been alive. But what veterinarians sometimes fail to do is value themselves as professionals. And we kind of shuffle our feet and say, oh, it's just advice. No, that's your professional service and you're very, very, very skilled. So make sure that the clients know that there's going to be a monetary exchange. The other thing that I recommend to veterinarians that are starting out with paid telemedicine is make sure the clients have access to free telemedicine. And we do that with our technicians and our nurses. So Mrs. Jones can still get free telemedicine in the sense that she can call for a prescription refill or she can call for general advice. But if there is something that needs to be diagnosed, prognosed, or prescribed, we're going to roll the doctor in and we're going to start out we use Medici, but we're going to start out on telemedicine. And in this day of the pandemic, that's a whole lot better for everybody.
Absolutely. So for those telemedicine visits, the client needs to be prepared, and they're not maybe at this point ready to have a telehealth consult with a veterinarian. So what do we need to be telling that client so that they are ready for that exam? Do they need to have their prescriptions to show you or records or have a video? What are some of the guidance pieces you tell CSRs to make sure that that is a very efficient and effective interaction?
Here's the brilliance of veterinary telemedicine. It doesn't have to be efficient because it can be asynchronous. So what we're doing right now is synchronous. I say something, you say something. This is Facebook Live. It's a real deal, right? But what veterinary telemedicine can be is asynchronous. That means text messages. That means videos. That means pictures. That is so much more efficient for the client and for the doctor. Because at some day, the pandemic is going to be gone and we're going to be able to give each other a hug and a high five. And when that day comes, if veterinary medicine is only doing synchronous telemedicine, it's going to be very difficult to maintain because doctors are really busy. So what we do in our clinic, I tried synchronous or like live video chats like we're doing on Zoom or any other type of platform. Clients didn't want me to see into their living room. I didn't really want to take the time out of my day. So what we do almost exclusively is, hey, send me a video of that dog's gums. Well, can you send me a video of the skin? Oh, and from a video, 20-second video, I get an amazing amount of perspective and the owner can do it on her time. That is key. And I think not a lot, the veterinary community doesn't know that that's available to them.
I don't think so either. And it's such a great point to bring up. I think there are still, though, even though there's so many people embracing this technology, there are some people out there that I would call late embracers, maybe, that are still a little hesitant to take on this technology. Some of it maybe is the technology is maybe a little overwhelming or scary in itself, but I know others have concerns that are we going to create antibiotic resistance, right? Because we're going to be, it'll be easy to just prescribe over a video platform, or are we going to be missing things where it's easy to prescribe an NSAID and we're maybe missing early kidney change?
You bet.
What is your response to that?
Oh, I'm so thankful for that realistic, skeptical point of view because it helps us all. So if you're one of those people that's like, I don't know, Smiley, boy, I'm thankful, right? Because you keep us all on track. That is such a healthy point of view. Now, here's reality. You've been offering telemedicine for a long time. Say it ain't so, but you've been doing it, right? You pick up the telephone or you shoot an email, you're offering telemedicine. So what I would encourage you to do is keep with your high standard of medical care. If you're concerned that that animal needs to be seen in the person, don't try to diagnose remotely. Get that cat in the clinic. But if you pause and you do a telemedicine inventory, you might come to find that you actually diagnose and prognose quite a bit remotely. It's not necessarily just with the latest, greatest iPhone. It might be with the old-fashioned telephone.
That's wonderful to know. Dr. Smiley, we'll be back with you in a little bit, and certainly feel free to submit any questions. We'll have a Q&A after Dr. Vogelsang. But thank you again for all of your advice. We're now going to turn to Dr. Vogelsang. Jessica, you speak with veterinary professionals about every single day right now about telemedicine. If a practice is thinking about implementing tomorrow, where do they begin?
Well, the first thing is don't panic. I think one of the biggest problems that I've been seeing so far is people say, I need to do the telemedicine, and they don't know what that means. And so they just Google it and they adopt the first provider they find. And then they have this tool in their hand with no clue how to implement it. The staff doesn't know what they're doing. And they're asking clients, do you want it? And they say, I don't know what that is. So don't panic, take a deep breath. And first, figure out, do you really understand what it is that you want to do? And I think Erin did a great job of laying some of this out, but everybody automatically assumes that telemedicine means live video, and that's not true. There are so many things that you can do with what you already have right now. So first, take a deep breath and make sure you understand what it is that you want to accomplish. And if you don't, I think being overwhelmed is probably the number one word that I've been hearing from everybody, and I completely understand, because there hasn't been a really great way for people to come together and figure out the answers to those questions. All of these resources are in development. I know of a couple of them right now. The first thing that I did a month ago was just start a Facebook group and say, all right, everybody huddle. And that's been fantastic. In 1 month, we've had about 3,000 people join the group just to kind of parse ideas back and forth. There are some organizations, AVMA, AHA, and a new group that just launched, Vivica, the Veterinary Virtual Care Association, that are all going to be here to offer resources. So don't rush into anything if you're not comfortable and don't feel ready. Ask your colleagues for help. We are here, and we've been muddling through this for a while, so we got your back.
So we're all taking deep breaths now and calming down, like your sign. Keep calm and telemed.
Yes.
Okay. So we don't have to jump on the first provider tomorrow, but that's a big point, right? Because there are a lot of people out there, a lot of programs and apps and tech services that are providing telemedicine opportunities for practices. So just like interviewing a new associate at a practice, what kinds of questions are we asking these providers to make sure that they're providing what our practice individually needs?
Yeah, and that's a great question too. I think a lot of it has to do with how much do you think you're going to use all of these different applications in your day-to-day work? If you're really comfortable with telemedicine and you think like you're going to be doing a lot of consults, you can jump right in. But if you already have, say, a service that offers like a two-way chat, like Erin said, so much of what people want and what value we have to offer can be accomplished with something other than that direct face-to-face live conversation. And so you may be able to do things with email or with chat. If you have gotten to the point where you're ready to bring on a provider, hopefully you already know in your head, how many of these live video consults realistically am I going to be able to do? Is my staff ready to start scheduling them? Are my doctors ready? Do I have a payment idea in my head? Am I going to send everything back to the receptionist at the end of this consult? Or do I really want a platform that can collect that payment? So there's all these little moving pieces, and each platform does them a little differently. So I think it's really difficult for somebody to look at a spreadsheet, and AVMA has a great list of providers, and we're collecting more. There's new every day. And to look at all the different check marks and say, well, I don't really know if I want that. For some people, it's extraordinarily important that a platform integrate with their PIMS. And for other people, they may not care as much. Maybe they're okay with a downloaded transcript that they re-upload. And so all of the little moving pieces are really, really difficult. So the important thing to know is to prioritize what is an absolute must-have for me, what's a nice to have, and maybe what do I not really care about, and then go from there.
Thanks for all those good points. Let's say though we have picked a provider and we're ready to start doing this. I think Erin brought up a really great point in the asynchronous part of this, because I think it's not well known, and probably for a lot of people, they didn't even realize that was an opportunity to do this. Because I think one of the most overwhelming parts of this is, how do I now implement telehealth into my workflow? We've been doing appointments for decades and decades and decades, but now all of a sudden, how do we put this into our day? What are some tips or advice that you can give to practices on that?
Yeah, and I think one of the most interesting things that's come out of this last month is everybody goes into it thinking this is going to be all about the live video. But the truth of the matter is, once COVID goes away, like Aaron said, I think people are really comfortable with going in and seeing the doctor, and that's what they want. But there's this whole big middle space, all of this time and resources that we've been giving away for free. And what telehealth and these tools offer us is an opportunity to sort of formalize those interactions. My own healthcare provider has done a really good job about this. When you go onto their website, they tell you that there's 3 types of visits. We offer just this little AI thing that you can go and you can plug in what your symptoms are and determine whether or not you need to come in, whether it's an emergency. That's what we call sort of tele-advice right now. There are services that you can call to do that. That's something that we do for free. The second level is they're calling it an e-visit, and that's what Aaron was describing before. You don't have the expectation that you're going to be talking to someone directly, but you just send in a video or an email describing your symptoms, and then you get something back. And they tell you whether or not you need to come in. And that little space right there is where I think is the greatest amount of value. And for you as a clinic, you have to figure out, how am I going to handle that? If I do want to have somebody giving advice, why do we keep making the doctors be the one to do that? We need to be doing a better job of training our technicians who are so fantastic at this about sort of parsing those things out, making sure that our CSRs are really comfortable with knowing, like Aaron said, certain words, you don't have to even talk to them. When they say something like the eyeballs bulging out or blood everywhere, like they know, and that's not a telehealth visit. That's a direct to ER. So I kind of call them my do not pass goes.
Right.
You have that list in mind. And then there's sort of that gray zone in between. And when there's a gray zone, who's in charge of determining whether or not that's an appropriate teleconsult? And hopefully the doctor doesn't have to be the one to make that call all the time, but that's going to take some thought and some training and some resources.
Yeah, so we have a lot of opportunity here for telehealth, but let's get to the elephant in the room for so many veterinarians, which is charging, right? So what are some basic guidelines, or are there any, on how we charge for some of these different levels of telemedicine we might offer?
Yeah, and that's sort of the big elephant in the room, like you said. I have heard everything from 50% of a normal visit all the way up to 115%. And a lot of it really depends on your comfort level for now. And I think, people have a really high tolerance right now for feeling things out that maybe they're not going to have in a little bit. But if you're doing a whole soup to nuts visit and you're taking the time with that patient, there's really no reason that you have to discount that, just because they're not coming into the clinic. And so I think there's this sort of sweet spot for a lot of people, right, in that 70-80% range. And Aaron, you can let me know what you think about that. But that seems to be kind of a good starting point. And then each clinic handles it a little bit differently because everybody has different sort of reimbursement strategies. If you get through that consult and you change your mind and determine that person needs to come in, then what do? Do you apply that amount towards the cost of the visit? And a lot of that just depends on your office structure. Is it going to be a different doctor that's seeing them? Are you a solo practitioner where you have some more leeway there? But that's sort of a good starting point, and then you can play it out from there. Aaron, what do you think?
Point. A lot of what I also do is I charge 100% of my sick exam as a telemedicine exam for exactly what Jessica said. Geesh, I'm giving the same professional service. And then what I will do if I need to have the pet come in for testing, I'll have them come in and then interact with my technician. The technician, let's say for otitis, the technician will swab, put it underneath the microscope, take a picture, put it back up on Medici on the app, and then I continue to interact with the owner asynchronously. So don't think that you're roped into an either or. There's a whole bunch of hybrid that goes on all the time. The other thing that we say, so when the owner connects with me, as a doctor, I can tell pretty quickly if this is something that's going to need to be seen in person. Amazingly, owners aren't stupid, and I have been shocked at how few, oh my gosh, my dog's leg is falling off, telemedicine calls I get. They just go right to the ER. They know that their dog's in trouble. They're not going to sit and ask me. Now, I do get the poison ones every so often, like, hey, dog just ate this, and we can turn those around pretty quickly. So in that regard, know that there's a hybrid. But what I tell people is, if I can't get this solved on remotely, then I'll refund the cost of the remote exam so you don't have to pay for 2 physical exams. And that tends to make owners a lot more comfortable as well.
That's great. And Dr. Vogelsang, one final question, sort of in the spirit of the late embracers, because we want to make sure we're representing all views. There are some viewpoints out there that telehealth we actually may lose some revenue stream for our practices because we, in theory, may not be seeing those pets as often, and maybe not doing as much routine wellness blood work screening, or maybe not having the opportunity to have a longer discussion perhaps about vaccinations or other important proactive things that we want to do as pets age. What is your response to that? And do you think there's any truth to that?
I think that there's a lot of fear, and that's what's really keeping people from investigating these questions. I mean, we have to keep in mind that COVID is sort of a short-term thing, really, in the big picture. And so if you're actually coming into it with the perspective that I'm trying to replace what I normally do with telemedicine just as a Band-Aid, then you're going to run into all these roadblocks. But what we need to do is look at the big picture, right? Once clients have the option of coming in or not, how do we make their lives more convenient, and how do we make our revenue streams better? So you are not trying to replace anything that you're offering with telemedicine. You're trying to add another layer. And I think we're really going to see a huge uptick in I know we sound like a broken record, but this asynchronous communication, because there's a chunk of time that you have to set aside, right, for every live visit. But in the meantime, if you can be doing these sort of e-visits where you're still handling questions, maybe generating revenue in all of this little in-between space, then that's actually a whole nother revenue stream. You can have a doctor who's at home handling these things. And we've already seen some people doing that quite successfully. They have a doctor whose only job it is to manage the telemedicine, and the clinic is still going with a full day's worth of appointments. So you look at it as an opportunity, not something that's going to take something away. To me, this whole fear is based in the idea that telemedicine is doing sort of like a low rent job of what we already do, and that's not it at all. Clients want good information, and they want it from us. They don't want to call some random vet no more than I want to call some doctor. I will do a telemedicine visit with a random doctor if I have no other option. It's better than nothing, but I love to get my own doctor on the phone because we have a trust relationship. And so telemedicine is just another opportunity for us to strengthen and build on that trust relationship, and to do it by meeting clients where they are.
What I would say is, with telemedicine, you bring the doctor closer to the client and the patient. That's always good. I haven't ever heard an argument that getting the client and the patient further away from the doctor is a good no. So to those naysayers, what I would say is this enhances your relationship with your client. If you're worried about not getting residual income, when the client can reach out so fastly, she's more inclined to ask you instead of Dr. Internet. You can give her great advice. And if you want to steer her into a product that you think is better, that would financially benefit you, I think you have an honest dialogue about that.
So many great points there. Of course, we also wanted to hear from the guiding voice of the veterinary profession tonight. I did have a chance to speak with Dr. Lori Teller. She's the Clinical Associate Professor of Telehealth at Texas A&M College of Veterinary Medicine and the Vice Chair of the AVMA Board of Directors. I started out by asking her about the legal ramifications we all need to be aware of if we are implementing telemedicine into our practices.
So it's really important, especially here in the United States, is to recognize that we all have to follow our own state's practice acts. Most states do have a definition for the VCPR, the veterinarian and client patient relationship. And in many states, you do have to have established that VCPR with a hands-on exam or a timely visit to the premises before you can use telemedicine. I'm in Texas, that's certainly the case here. Now, once you have established that VCPR, you can use telemedicine for whatever you see is fit. Other states do not have as strict a definition. Several states that do traditionally have that definition have waived it during the pandemic so that you can use telemedicine to establish a VCPR. It's also important to remember that there are federal laws involved here, not just state laws. So the FDA typically has followed the AVMA's definition of the VCPR, where you have to have had the hands-on physical or timely visits to the premises. And you can do that again to establish the VCPR and then use telemedicine as a follow-up for care. The FDA has waived that definition of the VCPR during the pandemic. So right now, for their purposes, which is for extra label drug use or writing veterinary feed directives, you can establish the VCPR remotely via telemedicine. Also, the DEA has a role in this. So certainly when you're prescribing controlled substances, they typically want you to have established the VCPR in a traditional manner. Again, during the pandemic, they have waived that and allowed for you to establish that relationship remotely. It's very important whether your state has the traditional definition or has a more lenient definition, whether that's permanent or just part of the pandemic, that when you are using telemedicine, you still have to maintain the same standard of care as you would when you are seeing the patient in a more traditional manner. And that would be true even for the FDA and the DEA as well as state boards. So that's very important to keep in mind.
And I think very important thing to bring up, because a lot of, we'll say, late embracers to telemedicine have those very concerns that there could be more antibiotic resistance because we're prescribing antibiotics without necessarily seeing the patient, or potentially missing early kidney disease in a patient on NSAIDs, those kind of things that we wouldn't necessarily perhaps miss if we have the patient here and we're doing blood work monitoring. But as you mentioned, telemedicine isn't sort of all or nothing, right? This is a tool we can use in the practice. And how do you recommend putting that into your daily practice with your patients?
And I think that's a great example of what you brought up. So skin infections, right? We see those in the clinic. We do our diagnostic workup, skin cytology, skin scrapings, because we want to make sure we're treating appropriately. But if you have an animal that you haven't established VCPR, and so you've seen it consistently, and you know it has seasonal allergies, and every year that flares up, the dog scratches and chews, gets a secondary bacterial infection, superficial pyoderma or whatever, and you need to put it on antibiotics, and you have a telemedicine visit with what could be a high-risk client that doesn't want to leave, and same symptoms as it's had every other seasonal flare, I think you can feel very comfortable going ahead and prescribing antibiotics as you typically would for that potential problem, and knowing that you have met the patient's needs, you're maintaining your standard of care because you've had this history, and you can do that comfortably. And of course, you're always going to give an owner the next steps. So you prescribe the antibiotics, you do the treatment, and you say to the owner, you know, if Fluffy is not doing better after so many days have gone by, then we are going to need to see Fluffy in the clinic because something else is going on.
So a lot of people are very excited to start doing this in their practices and combining this with their in-person visits and doing the best for our clients. But as I'm assuming a lot of people like us are out there, there's not a lot of time right now for us to be creating and reinventing the wheel per se. So we don't have to do that. What are some pain points or maybe missteps that other people have made so that we don't make them when we're trying to implement something here efficiently and quickly that can be used appropriately for our patients and clients?
So the first thing I would recommend is for anyone interested to go to the AVMA website. We have a microsite developed just for telehealth resources. There's some case studies. There's a great list of various platforms and providers if you want to go that route, even things about various models for pricing. And so that's where I would start because there's a whole lot of information available right there. I think in the long run, veterinarians tend to be our own worst enemies. We feel weird charging for our time. But once you've done this a couple of times, clients love it. They love the convenience of it. They love the fact that they're getting help and they don't have to get out of their daytime or nighttime pajamas right now. And they really eat it up and they're happy to pay for this. And that makes us much more comfortable doing it. So dip your toe in the water if you want, but I think after you've done a couple of these visits as a veterinarian, you will recognize that this is a true add-on benefit to your practice. You're not replacing anything. You're not detracting from the care that you offer in the hospital. This is just another benefit that you can provide to your clients and your patients to improve care.
Thank you to Dr. Lori Teller and the AVMA. Of course, you can always find the latest information at avma.org. Now let's bring back in our panel and your questions. And again, please send any questions that you have. We'll do our best to get to as many as we can. We have been getting some comments about the potential for bias within our guests. I know, Dr. Smiley, you do sit on a board for telehealth, and Dr. Vogel saying you're running a Facebook community and certainly advise and consult a lot on telehealth. I think the whole goal of our program tonight is really just to show as objective as we can the telemedicine opportunities within the veterinary practice. And certainly you both are big proponents of this. But maybe some of the viewers out there have some concerns that maybe telemedicine isn't right for every single veterinarian out there. And Dr. Smiley, can you comment on that a little further?
Yeah, absolutely. If you are considering or weighing the pros and cons, do I want to engage in telemedicine? I would ask you to do a telemedicine audit before you ever get started. Just like Dr. Vogelsing was saying, go through and ask yourself the question, how am I, if at all, currently offering telemedicine? My guess, and never say never always, I learned this in veterinary school, never say never always, but almost all veterinarians offer some type of telemedicine. So I view it much, much less as far as pro telemedicine or con telemedicine. As the veterinarians, we're great at telemedicine, and it would be very rare for me to run across a practicing veterinarian that doesn't offer her clients telemedicine.
Dr. Vogel saying any thoughts on that?
Yeah, I agree. I think that there's such a misunderstanding about telemedicine as sort of this either or thing. Telemedicine is just a means of communication. And unless every single interaction with your client is directly face to face, you are doing telemedicine or telehealth. The phone is a form of telecommunication, email, chat, live video. And so, yes, I'm pro telehealth because you kind of have to be, unless you're not going to interact with anybody except with that face-to-face thing. So I think that maybe there's some miscommunication about the terminology, and that's a problem that the entire industry has, even on the human side. So yes, I'm pro telehealth. If you don't want to do live video, you don't have to.
Good point. And I always make a point with people. I used to practice in North Central Indiana with the Amish. Guess who's great with telemedicine? The Amish. They love it, right? So especially during the recession, they'd call up on the phone and they beg me to diagnose and prescribe with the telephone. A lot of times I couldn't tell them what to do with the horse because I had to go out there in person. So when you think about telemedicine being something futuristic, think, oh, the Amish, they love telemedicine.
So we're getting lots of questions in. Let's get to some of those so we can answer as many viewers' thoughts as possible. Ray did ask, and I think I'll direct this to Dr. Smiley. It's based on a comment that you made. Do most veterinarians book a designated period of time for teleconsults? Dr. Smiley seems to imply that there's instant access. I don't see that as practical. Let's clarify that a little.
And I'm going to ask Dr. Vogelsang to tell you what most veterinarians are doing, because she's got a much better perspective on that than I do. I'll tell you as far as a study of one, so just the veterinarian from Indiana, I don't schedule any telemedicine calls. And a lot of times when I do conferences, veterinarians will say, oh, Smiley, you're crazy. Like, you don't have any free time. And then I say, how often do you send a text message during the day? Do you ever send a text message between appointments? Well, yeah, I like to send a text message to my wife, or my daughter always sends me fun pictures. Okay. So the way that I use asynchronous telemedicine is in that same interaction. I've got a few minutes between cases. I can sit with my phone, I can send a message back, and then I can walk back into the next exam room. I don't have to get it all the way wrapped up with a pretty bow at any specific time. That frees me up because we've offered paid telemedicine for about 3 years. So we were doing this before COVID, but that allows me to work it into my daily routine. And if you think about how multitasking veterinarians are, you guys are incredible multitaskers. You're answering phones, and if anything, it's freed me up because I can do callbacks now with text messaging on my platform. Oh my gosh, I get out of the door at closing time because I don't have to go through and make 15 phone calls because inevitably Mrs. Smith would like to talk about the weather. Mrs. Smith, I love you, but I don't want to talk about the weather. I want to get home to my kids and my wife. Jessica, what are most veterinarians doing?
Yeah, so I think that's a really, really important differentiation. Most veterinarians that are doing live video, so if they are actually doing a live real-time interaction, that's scheduled, of course, because you don't want to be giving this impression that anytime you call up, we're going to stick a doctor on the horn. So there's
Okay.
okay, I'm sorry. Um, so there's just this impression of a value if you do the live video. Aaron's talking about asynchronous communication, and that's actually extraordinarily efficient, right? So if I am trying to call someone and I have to get put on hold, and Mrs. Jones is trying to figure out the Zoom thing, that takes a lot more time than if they're just zooming off a text to you while they're taking the kids to the baseball game and you can answer it an hour later. Maybe the entire interaction takes place over the course of 3 hours, but each of you have only devoted about 10 seconds to each of those interactions. So asynchronous is not something that you have to schedule. But if you're doing live video, most people like to schedule it.
Dr. Vogt saying the other thing that I've noticed is by incorporating some type of text messaging, culturally, we accept some delay. So, like if you and I are texting back and forth and you don't respond to me instantaneously, I don't think that something tragic has happened to you. I think, oh, well, she's going to get back to me. Now, if you don't text me back for a day or two, I'll be like, oh, where's Jessica? Is she okay? So, what is so interesting is culturally, we accept this asynchronous interaction and value it as communication this day and age. Now, that may change 5 years in the future, but that's something that's out of our control that we can utilize. Is in America, the cultural norm of text messaging is asynchronous.
Absolutely. No, I agree with you 100%. And I think, for all of us, if you just take a second and you think to yourself in the own interactions that you prefer, like Aaron said, I actually would really rather just text my doctor a question and hear back in a few hours. It's all about managing expectations, right?
Yeah.
And so I think that this idea that they will get back to you when they get back to you is expected and normal. Nobody expects that immediate interaction. And I think most of us are trained. And if you're not, maybe you want to train your clients. If they have an immediate concern, call us.
Yeah.
And if you don't, and you're okay with us coming back to you in an hour or two, then you should feel free to use the text or the email. And so, a lot of this is going to become more apparent over time. But I think that it's really, really, it's what everybody's wanting to do right now. So meet clients where they are. That's what I would always say.
The other thing that we get is sometimes what we do is I'll have other veterinarians say to me, oh, Aaron, well, do I have to live in Silicon Valley? Do I have to live in the middle of Manhattan for clients to adopt this? And where I come from in central Indiana, and actually we practice outside of the greater Indianapolis area, it's classic Rust Belt Midwestern where the average age is 55 and older. And what I'll ask a lot of my clients that aren't necessarily tech savvy is, can you send a text? They say, well, Dr. Smiley, I can send a text, then we can interact. Now, when you're choosing a platform, I keep saying text messaging, and you might be thinking, oh, well, is he just using his iPhone to send text messages? I don't. I chose a secure platform, and I think that's important. Like what Dr. Vogelson was saying as far as that whole list, if security is one of your priorities, you need to look for that. It's one of my priorities, but I think that's definitely on the checklist, because what we don't want to do is make our records non-confidential and be out of compliance with your state regulations. So that's on that AVMA list. Make sure you're looking for that if you want to make sure that your records are secure.
Yep, absolutely. All of those things. And I'm not really aware of any one provider that does all things to all people. And so, to your point and some of the things that people were asking about, I think in the comments, there's infinite choices. And so when people ask you for a recommendation, I can't recommend a platform because I've talked to literally thousands of people at this point, and very few people are doing it the same way. I mean, there are people that are not sure whether or not they want to do this long term, that are stitching together. I call it like Franken medicine, where you schedule in Calendly and then they do the meeting on Zoom and then they collect payment on PayPal and they upload a PDF to their documents. You can do it that way. It's completely legal and fine. It's just a lot of extra work for you. So if time is not one of your priorities or convenience, feel free to do it that way. Or, and this is what I always tell people as well, nobody should feel pressured to do anything that they're not comfortable with. If you're not comfortable diagnosing in this way, then don't. Like, don't ever set up the expectation that that's something that you have to do.
Yep, absolutely. The other thing that I would say is it's going to be so like with VVCA and other organizations coming online to produce standards. I think that's going to be so helpful as we navigate these waters, because what I hear over and over is veterinarians wanting more concrete stability in this environment, and I'm very sensitive to that. So I'm excited about VVCA starting up and AHA and AVMA looking into these best practices to give veterinarians better guidance in specific cases.
Yeah, I think that will really help people feel a lot better when you get
Mhm.
the subject matter experts, and we know they're there. They're getting lined up already. You know, one of the biggest use cases, right, Aaron, is dermatology. And so we've got
Yeah,
this whole cadre of fantastic dermatologists that are telling us very
you bet.
clearly these are the appropriate use cases and these aren't. And I think people will feel a lot better once they have that in front of them. But, you know, I have a friend who's a neurologist and she's doing, you know, these consults, and she's doing it because she has a lot of elderly clients where transportation
Mhm.
is an issue. And so that's her comfort zone. But I think as we see these standards, it is going to become a lot more clear for
Yes,
people what's
I totally
appropriate
agree with
and
you.
what's not appropriate.
Yep. What I would also say, as far as you go along, um, don't have to necessarily. I would say don't be afraid of it. I mean, I just would try to speak into that fear, and I'll tell veterinarians too. Remember, you're worth it. And veterinarians will kind of look at me half cockeyed and, what are you talking about? Well, the telemedicine that you're currently offering, why don't you monetize that? Well, I just think it's advice. Nah, you're worth it. And I think that as a community, as we embrace that, I think it will definitely allow all of this just to flourish. And it's not a money grab, but it's a self-awareness that our medical professional opinion, people value that. And when I get done with a paid telemedicine consult, the most common, overwhelming common response is, thank you. I just took their money to give them advice in an asynchronous fashion with videos and text messages. And you know what they say? Thank you. Thank you,
Yes.
Dr. Sawyer. It always amazes me.
It's so true. That's something that I've seen over and over again in the Facebook group when people ask questions and they're worried that clients are going to push back. I would say 99.9% of the pushback is from veterinarians who are
Yes.
scared of clients yelling at them,
Yes.
and not as
I agree.
the clients have not pushed back. It's
No.
convenient. They're so happy that they don't have to stuff their cat into the carrier.
Yes.
And if you've done a good job managing your expectations
Yes.
and giving them appropriate advice, they
Yes.
know when you
Yep.
go in why you need to go in
Yep.
and what it is that you're going to be doing when you get there. And that alone solves so much of their uncertainty. They're just
Yep.
very happy knowing that I didn't give up my afternoon for something that I really didn't need to come in for. So our knowledge is so much more than that one diagnosis. It's everything else in the middle. And so
Totally.
valuing ourselves, clients value us. It's our turn to value ourselves as well.
Yep. Agreed.
Such great conversation. We do have a question from Amy. What should you do if a person reaches out to you with a pet problem and you do not have a VCPR yet? Can you create such a relationship with a good history video conference if this is the only option the client has during COVID-19?
You want to take that, Aaron? Or?
Yeah, okay, and then you can jump on it. Make sure that each state is a little bit different. So make sure you're well versed. Call your state VMA and make sure you're well versed in the laws in your specific state. What you can always do is you can triage anything. You can triage anything. And then there's also, in most states, and I don't know what your specific state laws are, there are asterisks for emergencies. Now, who determines the emergency? In Indiana, that's not completely well defined. So make sure that what I would encourage you to do is go back to your state VMA and ask that specific question. And I bet that there's some place of a get around as far as in an emergency situation.
Yeah. You know, whether or not you can establish a VCPR remotely is probably one of the most contentious, confusing issues, even for people that are following this full time. AVMA, AAVSB both have the most current versions of each state up there, but it's changing every day with new executive orders. And so I would say if you're not comfortable, you're not sure, don't go down that road and do the VCPR because you don't want to run afoul of the law. But to Aaron's point, there is so much general advice you can give.
Yeah.
Triage is always okay. And when we talk about triage, that's basically saying, listening to what they're telling you, does this need to be seen this second? Does this need to be seen shortly? Or is this something that can maybe wait a few days? These are my differentials. Differentials are not the practice of medicine. Differentials are general ideas. So it might be this, that, or the other is okay to do. And so, what I always tell people, we are in a pandemic, and our mandate as veterinarians is to improve the clinical outcome. So, you have these rules and these regulations that you need to function within, but within that, help them, improve the outcome. And if you can do that, then you've accomplished what you're supposed to be doing.
We're getting lots of comments, lots of varying opinions. Lorraine actually has said here, I like to see my vet personally. And I'm happy that she does. We like to see clients too, but I think you've been commenting a little bit on, this is not a end all be all. We're not switching our practices solely to this. This is a tool in our toolbox. But do either of you want to comment back to Lorraine a little more specifically about that?
Lorraine, what I would say is that telemedicine strengthens the relationship that I have with my clients. Because what they can do now is they can send me a text message or a video directly to my phone. How many clients would love to have my cell phone number? Most of them. I'm not giving it out because I still want a life. So when you think about telemedicine, think, would my clients want to be able to contact me? Yes. Now, with different technologies or by using different modalities, you can monetize it. That's a win-win. So I do not see this as any way me not communicating or interacting with my clients. I'm actually interacting with them more now.
Yep. And Jessica, if I can actually steer another question your way, Patty is asking, since we've been giving out a lot of telemedicine advice for many, many years without charge, how do you train clients to pay for asynchronous visits? I think it's a very important question.
It is. And I think that's when you start to sort of parse out this idea of quick advice. Is this the sort of thing that, a CSR would answer really quickly over the phone? You don't all of a sudden want to make clients feel like you're taking something away. Something I used to give for free, I'm now charging for. So you need to make sure that you're adding value and sort of packaging it in a new way. And so there's a differentiation, right, between that quick advice and we're actually going to take a little time to talk to you and maybe give you some advice. Is that something that I'm going to have my technician handle? And are we going to call that a teleconsult? I think, some of the things that increases perception of value in people's minds are, I'm scheduling this. You're going to be talking to somebody, or if you just kind of use that terminology and make them understand that this is somebody who's going to be taking some time with you. I think the asynchronous is a little tricky when they send you a text. And so, Erin, maybe you want to sort of share how you are parsing those things out, because I think it's a great question.
People find value when I tell them, or my technicians or reception staff tells them, he can diagnose and prescribe over the phone. And they say, well, what do you mean? Well, you may not have to come in. If you do have to come in, you're not going to pay for 2 visits. Oh, it's such a paradigm shift in the veterinary community because the clients are so used to saying, from the reception desk, I can't diagnose, you need to bring Fluffy in. I don't know if I want to bring Fluffy in. I'm real busy. So what adds value, even of that simple asynchronous text, he can take care of you remotely, and clients just aren't aware that it's available.
Well, we have so much we could discuss here, but unfortunately we're running out of time tonight, and that's going to wrap it up for us. But I really want to thank our host, the Viticus Group, for making this content possible for all of our viewers. You can find more resources by visiting wvc.org and clicking on the COVID-19 Veterinary Information button. Thanks also to our guests, Dr. Scott Weiss, Dr. Erin Smiley, Dr. Jessica Vogelsang, and Dr. Lori Teller in the AVMA. I'm Dr. Natalie Marks. Until next time, stay safe and healthy.